Mike Gibson and Jim Forrester coming to you live from SCAI 2016. Jim, you have a book out, Heart Healers, the misfits, mavericks, and rebels who created the greatest medical breakthroughs in our lives. What is it about mavericks? Why do we need mavericks in medicine?
Well, there's a wonderful quote from Steve Jobs about mavericks, and he says, here's to the mavericks, the square pegs in the round holes. They don't follow the rules. They pay no attention to conventional wisdom. You can glorify them or you can vilify them, but you can't ignore them. And the reason is that they change the way things are. You can, some will say they're the crazy ones, but Steve Jobs said, I see genius, because the people who think they can change the world are the ones who do.
Right.
And that's what it turns out, that the people who made the great advances in cardiology were all mavericks.
Absolutely.
Let's start at the beginning. Astonishing.
Let's start at the beginning. Werner Forsman, a urologist, inserts a catheter up into the heart.
Yes.
Gets fired, right?
Yeah.
I mean, he got fired for doing this. This is the first pulmonary artery catheterization. Talk to us a little bit about that.
Well, here's what happened. He was an internal medicine resident at Eberswalde, which is about an hour northeast of Germany, of Berlin. And he got the great idea as an internal medicine resident that he could, instead of putting the cardiac drugs in the vein, he could pass a catheter up into the right atrium and deliver them there, and it would be better delivery of cardiac medications. So he went to his boss, whose name was Dr. Schneider, who flew into a Teutonic rage because he said, you'll kill the patient if you do that, you may not do it. So Forsman pretended that he accepted it, but he was in a sea of nubile nurses, and one of them was a young lady named Gerda Ditzen, and Gerda, he was smitten by Werner, and he convinced her to, she had one distinguishing characteristic, which was she had the keys to the supply cabinet.
Right.
So he went, and there were no cardiac catheters at that time, because there was no cardiac catheterization. So he got a urinary bladder catheter, and then convinced her to go to a remote part of the hospital where she lay down on the bed, and he strapped her down. And you imagine that, oh my God, he's going to risk this young lady's life. But no, when he had her strapped down, he catheterized himself.
Right.
And then they walked down to the basement, which was where they had the fluoro unit, and he documented that he had passed the catheter into the heart. And for that accomplishment, he was banned from all cardiology training, and he became a urologist. He was a urologist after but he, in that interim, he published a picture of what he had done in the leading German internal medicine journal. And 10 years later, Cournand and Richards, two American physicians, used cardiac catheterization to treat young men in World War II, soldiers who were injured. And that was the birth of cardiac catheterization, a most bizarre story. And of course, the maverick in this case was a guy who took tremendous risks with himself to develop cardiac catheterization. So Cournand Richards and Werner Forsman won a Nobel Prize.
Yes.
And people said that Werner Forsman was the least intelligent man ever to win a Nobel Prize. But at least he was the most daring.
He was the most daring man to ever win a Nobel Prize. What about some of the others? Talk to us about Harkin.
Dwight Harkin is actually, in my view, and one could think of several names, but I believe he most deservedly is the father of cardiac surgery. And he began in World War II with young soldiers brought into his battlefield hospital in London, where he saw chests open and shrapnel sticking out of the, I think most of the time out of the right ventricle, probably some of the times out of the LV. And he knew that booming down through the ages was the voice of voices of various surgeons who said, you must not touch the heart, you'll induce ventricular fibrillation. But he was a maverick, and so he decided he would challenge conventional wisdom, and he went ahead, put a clamp on the shrapnel and yanked it out, having put in a purse string suture just before. Stuck his finger in the torrent of blood that came into his face and managed to close that lesion after the blood came roaring out at him. And the only problem was that at the end of the procedure, he had sutured his surgical glove into the heart.
Into the heart, yeah.
And so he had to cut it off. And I knew Dwight years later as a fellow, as you were at the Brigham.
Right.
And we used to say, well, you know, he could have cut his finger off and got the same result. But Dwight was a fascinating guy. He was a terror in the OR, and he was a charmer outside. And in my lecture, I quoted a quote about President Roosevelt from his daughter, who said that he wanted to be the baby at every christening and the bride at every wedding and the corpse at every funeral.
Right.
That captures Dwight Harkin.
His nature, his personality.
Yeah.
What about Lillihei?
Walt Lillihei, highest highs and lowest lows of any person that I've known in all my years of cardiology. Brilliant man, went to college at age 16. You know, he was that kind of intellect. And when cardiac surgery was developing, there was no way to operate on an arrested heart. And he came up with the brilliant intuition that since a mother can sustain the life of a baby in utero, why couldn't a mother or a parent be connected to a child while that child's heart was arrested in life? And so he invented what was called cross circulation. And he successfully operated on VSDs and ASDs.
Wow.
And the tragedy of Walt Lillihei's technique was that after he had done maybe 10 or so, one of his patients had an air embolus to the brain, and she was unable to take care of her kids afterwards. She was 34 years old. And that was essentially the death of cardiac out of cross circulation. But it proved that it was possible to operate on an arrested heart, and soon segued into the development of the heart-lung machine.
Wow, fascinating.
Now, Walt, that was the high. He was the best, the brilliant man of cardiology. And then, sadly, he went to Cornell, and he failed to pay his income tax for 2 years, and the IRS got after him, and then he paid, and then for 3 consecutive years after that, he didn't pay, and the IRS decided to make him the butt of a show trial. And in short, I won't go through all the things that happened, but he was essentially humiliated in court, and humiliated in such a way that the medical profession turned their back on him. He lost his Minnesota medical license. People wouldn't talk to him and so forth. And one of the most poignant moments in American cardiology is when he was recognized by the subsequent president of the American Society of Thoracic Surgery about 10 years later, and called to stand up, and he stood to the applause of 1,000 hands, and he was recognized for the great cardiologist that he was, resuscitated in effect, and went on to become the medical director of St. Jude's, and passed away in his 80s with, at his 80th birthday, the young lady that he had done that first surgery at his birthday party.
Wow.
Fascinating guy, a wonderful sense of humor, and no respect whatsoever for the conventions and mores of society. He got himself into a lot of scrapes in his fascinating career.
How about Soanes?
Mason Soanes, I said about Mason Soanes, I think I say it in the book, I'm not sure, that back in the day, Reader's Digest had a feature they called The Most Fascinating Person I Ever Met. And Mason, if I'd been asked, I would have written about Mason.
Yes.
I think he was a kind of a short guy with glasses. He probably wasn't a super popular kid when he was growing up. And he delighted in being an iconoclast, in challenging, and he would kick open the doors of the ladies' room and yell in, "Get back to typing," and things, that were just outrageous.
Right.
He was a heavy smoker.
Is the story true? The story I always heard about Mason Sons was he lit a cigarette, he put it down in the cath lab, went over, did the brachial approach, did a cath, but by the time he got done with the cath, he was able to go back up and finish the cigarette.
Yeah,
Is that a true story?
Yes, it is, Michael.
Yeah.
And the thing is that he had sterile forceps.
Oh, so he could smoke during it.
So it was puff of dye, puff of cigarette.
Well, back in those days, the ad said, a Camel, it's good for you, right?
That's right.
Yeah.
LSMFT,
Yeah,
I remember. Lucky Strike means fine tobacco.
Yeah.
Yeah, and so Mason one day was doing an aortic root angiogram, and he accidentally, as he hit the power injector, his assistant hit the power injector, it flipped like a garden hose right into the right coronary artery.
Yes.
30 cc's power injected into the right coronary artery. And you can imagine
Yeah, a lot of dying.
what happened next.
Yeah.
Heart stopped.
Heart stops.
But as he stood there aghast and probably yelled cough, 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 because that's what we did in those days. The guy's heart rate came back, and Mason, instead of collapsing on the floor in relief, strode back to his office and bellowed for all to hear, "I just revolutionized cardiology."
Yeah.
And of course he did. We have that first coronary angiogram. It's a right coronary injection.
Really?
And,
It's archived? Where is it?
It's on ptca.org.
Yeah.
So it's fun to see. It's not a very good angiogram, by the way, pretty low quality.
Well, but the point is, it was done. Yeah.
Well, when he bellowed, "I just revolutionized cardiology," legend has it that Elaine Clayton, who was his secretary for 24 years or so, looked up from her typing and she said, "Again?" But this time Mason was right.
Yeah.
It was a paradigm shift in cardiology because it showed us the atheroma for the first time in life.
Absolutely. And then, of course, that was visualizing the arteries and fixing them with Grunzig. What are some of the stories there?
Well, Andreas, I first met Andreas when he was a young Swiss. He was invited to lecture at Aspen, and he arrived with his lovely wife, Michaela, and he and Barbara, my wife Barbara, and I arrived late, as usual, and so the four of us had dinner together at the speaker's dinner. Charming, charismatic, good-looking guy. I was so jealous.
Yeah.
But
I've never seen a bad-looking picture of Andreas. Yes.
Yeah. Well, his nurse Spencer King subsequently recruited him to Atlanta, and one of his nurses there said he was a cross between Clark Gable and Errol Flynn.
Yes.
The Clark Gable part, he certainly looked kind of like Clark Gable, and the Errol Flynn part was the dashing, attractive to every lady part. Andreas was in Zurich, was a maverick.
I'm just going to get this and keep going.
Andreas was a maverick in Zurich. He had the idea that maybe you could put a balloon in a coronary artery, inflate it, and push the stenosis aside. And that was ridiculed by his bosses in Zurich. And in a sense, they were right, because when he tried it, all that happened was the balloon would indent. And so he spent 3 years working in his kitchen, trying to figure out a way, and ultimately decided on a bladder instead of a balloon. And he figured out a way to deliver air to the bladder and so forth. But it took him 3 years of failure, until he finally got it so that he could take it to the dog lab, where he did dog studies. And he brought it to the ACC, American Heart Association, in 1976. Perhaps you saw it. I know Spencer King saw it at the AHA meeting. Everybody ignored him pretty much. And so he went back and did the first human angioplasty, and a guy named, do you remember his name by any chance?
Gosh, I can't remember.
Dolph Bachman.
Yeah, he came back a few years ago, and at the
Dolph is still alive today, and it was a high-grade LAD stenosis.
Proximal LAD.
Proximal LAD stenosis, and it was a single stenosis. Bachman was only 39 years old. He had grade 3 angina, and he was a heavy smoker. And he brought his results, his first 4 human angioplasties, to the AHA the next year. And the most amazing thing, in the middle of his presentation, right while he was showing his angiogram, people broke into applause. And at the end of his 10-minute lecture, he received a standing ovation. Mason Sones came up and said, "I want to review all those angios with you."
Absolutely.
He had brought the Tajarno films. That was the birth of angioplasty. As you probably, maybe you even went there. He had, the world came to Zurich. He had symposia for like 300 people.
Absolutely.
And then, of course, he continued those when he came to Atlanta. He changed when he went to Atlanta. In the book, I suggest that maybe he was Icarus. You know, he made a great deal of money from the catheters. He divorced McKella and married a lovely young medical student whose name was Margaret Ann Thornton. And he bought a plane. He got a huge mansion in Atlanta, staged lavish parties there. He became a pilot and flew to Sea Cottage, which is about an hour south of Atlanta, for the weekend with Margaret Ann. And on the way back, he ran into, or knew about, Hurricane Juan, and he got completely turned around. He had very little experience in instrument flying, and he ended up flying in exactly the wrong direction, and he plowed into a Georgia field at 300 miles an hour, and we lost what I think you and I would probably say is our greatest cardiologist of our mutual era.
Yes.
A brilliant maverick.
Yes.
In his early 40s. What a tragedy.
What a tragedy. Well, it's all here. Get the book. It's on Amazon, I'm sure.
Yes, it is.
Yes.
And it's an unvarnished tale of cardiology.
Just the way I like it. Jim, thanks for coming by.
Michael?
Thanks for sharing those stories.
So much fun to be here, Michael.
Thanks for coming, and thanks to all of you for coming here for SCAI 2016.